Fantastic. It's great to see so many people joining us live today. So if you're watching us right now, I'm going to tell you how you can get involved. If you are watching this on recording, you're also very, very welcome. My name is Elizabeth. I'm Chief Executive of the Digital Poverty Alliance, which is a national charity seeking to end digital exclusion in the UK once and for all. Carol, could I ask you to introduce yourself?
Of course. Hello, Elizabeth. Hello, everyone on the call today. My name is Karol Kudzera. I'm a senior healthcare policy manager in the National Healthcare Inequalities Improvement Program. And we, together with Will Jones and other colleagues that I will talk a little bit about, developed the Digital Exclusion Risk Atlas, which we are very, very happy and delighted to be sharing with you all today. Thank you.
Fantastic. And we are very excited to see it. Will, can I ask you to introduce yourself?
Absolutely. Good afternoon, everybody. I'm Will Jones. I'm a principal geospatial analyst within NHS South Central and West. And yes, working with Carol and kind of been involved. So my role is more geospatial, so kind of been involved in building the application and creating the visuals in the DERA Digital Exclusion Risk Atlas, which we'll show off later. So yeah, happy to be here. Nice to see everyone.
Amazing. If you are joining us live, we love hearing what you think. We run these webinars live so that we get that interaction. So please do use the chat. Let us know who you are, which organisation you're representing, whereabouts in the country or indeed in the world you are. You can also use the Q&A function, which is down at the bottom of the screen. And we will come to as many questions as we can at the end of the session. So just to kick us off, Carol, digital health and care services are increasingly part of how people book appointments. It's how people access information, manage their care, communicate with services. What risk, though, does that create for people who already face barriers around digital access, affordability, skills, confidence?
Yeah. It's a really, really great question and very probing too. Well, I think we need to start with recognizing that, generally digital technology can make healthcare much more convenient and it can give people much greater choice and much greater control. But, and I think it's a big but, if we assume that everybody has the same ability to use it, we are risking creating a new barrier to care. So digital exclusion is not simply about whether someone is online or offline. And I think we will unpack this a little bit further today as well. So for example, a person may have a smartphone, but for example, maybe rationing the data. They may be sharing one device across a whole household. They may have problems with the connectivity. They may be using a device that is not suitable for completing a complex health task. And they may also need support because of accessibility, because of literacy, and because of language, or indeed the confidence or the trust in the process. So when those barriers are not considered, people may find it much harder to book appointments. They might find it much harder to receive and understand information or communicate with services, or, for example, if they need to manage their long-term condition. So the risk is that digital transformation transfer the additional cost and the complexity onto the people who may be least able to absorb it. And really, that is why the digital services need to be inclusive by design, supported where necessary, and offered alongside effective non-digital routes. And I will talk about this a little bit further today. So the aim really should be to widen access and to widen choice and not to make access to health conditional on someone's ability to use a particular technology. So I hope that's a good wrap around this question. But we really need to be able to recognize where people are and go with that.
Absolutely. And as you say, where there are those digital transformations happening, recognise that there is a cost gap around that for individuals.
Yeah.
And of course, it is often treated as a practical access issue when we think about how digital exclusion is perceived. But in health and care, why does it need to be understood more widely as a health inequalities issue?
Yeah. Yeah. I think this is really an important kind of pivot in our understanding of how we approach digital exclusion, because digital exclusion is a health inequalities issue, because people who are most likely to face barriers are often also those who experience poorer access to services and poorer experience of that services, and that translates into much poorer health outcomes. And, that can include people on low incomes, some older people, for example, people who are disabled, people with lower educational attainment, people, as I said, who may need some language support, um, or indeed, people living in areas with bad connectivity. And these characteristics can really overlap, they can really intersect, so that people may face several barriers all at the same time. So it's not just one thing. It can be really compounded. Um, and I think that the important point there is that it should not be framed as an individual problem or, for example, I don't know, a lack of motivation, because we know that affordability, housing insecurity, access to appropriate devices, disability, and indeed the design of services are all structural conditions. So they shape whether people can engage with digital health consistently and independently. So digital exclusion can really, as I said, compound those health inequalities, but by making healthcare harder to reach, harder to navigate, and harder to use. And us at NHS England, as well as all the integrated care boards, we all have a statutory duty to consider inequalities in access and in outcomes from health services. And so addressing these barriers to digital healthcare is part of meeting that whole responsibility.
And I think it's really interesting to see digital exclusion caught into that statutory responsibility around inequalities. And of course, you and your team and Will have put a huge amount of work into the Digital Exclusion Risk Atlas. So I think you're going to spend a little bit of time now taking us through some detail on that.
Absolutely. And yes, and thank you so much for those warm-up questions. They certainly got me warmed up to share with you. I think quite a really interesting and very exciting project that we did on the Digital Exclusion Risk Atlas. So we do have quite a full and I hope very useful session for you today. And really, I wanted to also start by thanking you, Elizabeth, and the Digital Poverty Alliance for hosting and supporting this event, and really for helping bring us together, colleagues with a shared interest in how data and insight can really support the action on health inequalities. And I'm going to be talking an awful lot about health inequalities today. So, over the course of this session, you will hear about how we developed the tool, what the data can tell us, and how it can be used in practice. I would really encourage you to think how this insight might support your own work, and in particular in reaching communities who are more likely to experience poorer access, poorer experience, and poorer outcomes from health services. And you will hear me kind of coming back to these access, experience, and outcomes quite often in this as I will talk. We've introduced ourselves today already, so we can skip that slide, Will, and we'll go on to the running order. So I'll begin with a brief introduction to the immediate team who have been absolutely instrumental in developing the Atlas. Then I will talk briefly about healthcare inequalities, and we've got a flagship program. Hopefully it's known to the audience here. It's called Core 20+5. And I will set the wider kind of context of this work, especially around digital inclusion and its national healthcare policy drivers. I will then take you through an overview of the Digital Exclusion Risk Atlas before I will hand over to Will, who's an absolute delight to work with and a geospatial expert. And he will talk about the drivers of digital exclusion, and then we'll do the demonstration of the atlas. So I'm sure you will. That's the bit that you're most kind of excited about. I definitely am. Right. So next slide, please. Just very briefly, I wanted to recognize the team behind this work because really it's been a huge teamwork. And we brought together colleagues from various NHS England's national and regional teams, as well as South Central, West and Midlands and Lancashire clinical support units. And we've also been really incredibly fortunate to be able to work with a group of subject matter experts, and their input really helped us to kind of to shape the atlas, to challenge us as well in terms of our thinking, challenge some of the variables that we were using then, and how we weighted them, and we'll talk about it a little bit more later on. So yes, all of this has really helped us to design the methodology of the atlas that you will see today. Next slide. Next slide, please. And the next one. So to give this work a little bit wider perspective, I want to start by focusing briefly on the gap in the healthy life expectancy. So we know that there are very significant inequalities, not only in how long people live, but also in the proportion of their lives spent in poorer health. And that is really important. So the graph on this slide will show the scale of that gap very clearly. These are the orange areas. So for women living in the most deprived areas of England, healthy life expectancy is just over 50 years, and then they spend around 27 years in poorer health. So that means that roughly a third of a life is spent in poor health. And importantly, poor health often begins well before their retirement age. Now, when you contrast it with women who are living in the least deprived areas, they can expect to spend over 70 years in good health, with few years in poorer health overall. So this is a really stark reminder, I think, that deprivation is really strongly linked to early onset of major illness, longer period of poor health, and reduced opportunity to live well. And the gap between our most and least deprived communities remain a major challenge. We know that very well, and this is something that we absolutely must address and continue to address urgently and systematically. Next slide, please. So this is where the core 20+5 approach becomes so important. And core 20+5 is the NHS England's national approach to supporting the reduction of healthcare inequalities at both national and system level. And it helps us to focus our efforts on the people and communities who are most likely to experience poorer access, poorer experience, and poorer outcomes from health services. There it is again. So the core 20, it refers to the most deprived 20% of the national population, and that is as it's identified by using the index of multiple deprivation. So these are communities where we often see the greatest burden of ill health and the widest inequalities. The plus element of that core 20+5 recognizes that there are also locally identified groups who may experience poorer than average health outcomes, but who may not necessarily be captured directly by the core 20 alone. So that's why we've got that plus. And these groups will vary by place. They may also include inclusion health groups. So, for example, people experiencing homelessness, ethnic minority communities, and people, for example, with learning disability or any other sort of marginalized groups who may need a very sort of tailored healthcare approach. And finally, we've got the 5, and the 5 refers to the 5 clinical areas where accelerated improvement is needed. So we've got maternity, we've got severe mental illness, we've got chronic respiratory disease, we've got early cancer diagnosis, and hypertension. And the strength, I think, of that core 20+5 approach is that it gives us and the whole of the NHS a very, very clear framework for action. It asks every part of the NHS to understand who is experiencing inequality. It helps us to identify the relevant target populations, and it helps us to consider what practical action may be taken or needs to be taken to improve outcomes. So even when a service is not directly responsible for one of those five clinical areas, and that may be, very relevant to your workplaces and the work that you are doing in this space, and I think everyone still has a role in reducing health inequalities. So the question I like to ask us all is, who is our core 20+5 population, and what are we doing differently to meet those people's needs? Next slide, please. So this brings us to digital inclusion. So as more services are becoming digital, we absolutely need to make sure that digital transformation does not widen existing inequalities. We know that digital tools can improve access, they can improve choice, and they can be quite convenient too, but only if people are able to use them and benefit from them. The image on this slide, which I hope is quite familiar to you, is showing the difference between equality and equity. So treating people the same is not always enough, because we know that some people and some communities will need additional support, a different route in, a more tailored approach to achieve exactly the same outcome as the rest. So in the context of the digital health, that means asking who is digitally excluded in our communities, who may struggle to access online services, who may struggle to, for example, use the NHS app or to navigate the nhs.uk, or who may benefit from digital pathways. So there's lots of really kind of probing questions there. And most importantly, what support, what alternatives or safeguards do we need to be thinking about, and what do we need to put in place? And today you will hear more about the Digital Atlas and how it can support action to reduce inequalities. And as you listen, I would really encourage you to think about how this tool can help identify the communities most at risk of digital exclusion, and how that insight can be used then to improve access to services. I really think that the challenge for all of us is to ensure that digital transformation is not just about making services more efficient, but it's about making them fairer, making them more inclusive, and more responsive to the needs of those who face the greatest barriers. Next slide, please. So I hope that it illustrated the wider context of this work and our roles in reducing health inequalities. And I'd like to build on that a little bit and start to ground this in the sort of broader shift we are seeing in digital healthcare, because we know that digital is not neutral. If we get this right, we can improve access, we can improve experience, and we can improve outcomes for people. But if we get it wrong, it risks widening inequalities. So we know that digital inclusion is much more than a question of connectivity. You've heard me say that already. We know that from research that affordability, skills, confidence, trust, age, disability, and place, they all shape whether people can use digital health services. And in England, the national data tells us that digital access is expanding. In 2025, full fiber coverage reached 79% of residential premises, and 57% of UK adults who are online use the online NHS services. But we also know that digital exclusion persists. It's not an easy thing to solve. It's what we call the wicked issue. So around 6% of adults still have no internet at home, and 2/3 of those who are offline are aged over 75 or over, and around 18% of labor force adults still lack essential digital skills for work. So we developed DERA to make that risk of digital exclusion visible. We brought together 12 indicators into a composite risk score across 4 different domains, and will talk about this in a little bit more detail later. But in practical terms, the Atlas helps us to see whether where the risk of digital exclusion may be higher, what might be driving it, and what kind of local response may therefore be needed. So that could mean, for example, that we need to improve connectivity. We need to build digital skills and confidence in people. We need to be working through trusted community partners. We need to be thinking about improving accessibility or indeed maintaining non-digital access into care. And I think that point is really, really important, that whatever we say here, digital by default must never mean digital only. Digital transformation absolutely should give people more routes into care, not fewer. It should allow people to move between digital, hybrid, in-person support, depending on what is safe, what is effective, and what is appropriate. Next one, please. So we grounded our work on DERA in a very strong and evolving policy context. We translated that policy into something that is actionable. So starting with the NHS framework for action on digital inclusion, and I'm sorry this is a little bit dense, but please bear with you. You will see how it all links into DERA. So the NHS framework for action on digital exclusion sets out a very clear expectation of the NHS that inclusion should be embedded across access, across skills, across confidence, and accessibility. So the Atlas really provides that visibility across those dimensions so that systems can identify which barriers are most significant in different places and to respond to it in a much more targeted way. You may be aware that the government also published the Digital Inclusion Action Plan, which calls for much more coordinated data-driven approach across sectors. And again, DERA supports this by providing a much more shared and consistent evidence base, which can be used not just within the NHS, but alongside local authorities, voluntary and community sector organizations, and whoever has a stake in working on reducing the digital exclusion, or indeed works in digital inclusion. And lastly, within the 10-year plan, we see the ambition of a much clearer shift from analog to digital, with digital becoming the default way of accessing care. And as you heard me say this before, in terms of digital inclusion, this creates both an opportunity and a risk. And the role of the Atlas here is to provide the insight that is needed to ensure that digital services are designed with inclusion from the outset. So what is DERA? But before I hand over to Will, just to before the live demo, just to kind of wrap it up. So the Digital Exclusion Risk Atlas, or DERA, that's how we call it in short, is effectively a geospatial analytical tool which is designed to help identify and understand patterns of digital exclusion across England. So unfortunately, Wales and Scotland is not, or Northern Ireland is not included. It's only looking at England. It brings together multiple evidence-based indicators into a single risk view, which you will see, and it will help to show where people may face barriers in terms of accessing in terms of access, in terms of affordability, and using digital health services. We want to drive that targeted place-based intervention and bring it together with the decision making so that local systems and partners can much better understand where the additional support may be needed. And really importantly, I think from our perspective, this is a public tool available to all. So it draws on a range of national data sources, including Ofcom, NHS England, ONS's census and population data. And we ensured that this tool is not just sitting behind a login or some subscription, that it is publicly available to all of you. Right, so Will, I will hand over to you. You've been very patient, and thank you very much. And this is the exciting part of the presentation today. Will.
Lovely. Thanks, Carol. Yeah, so before we get into the Digital Exclusion Risk Atlas itself, I just wanted to give a bit of background as to what is made up the DERA. So, as Carol just mentioned, it is made up of many different interrelated factors. In fact, there's actually 12 different indicators which we've combined together to build this composite risk index. And I think, as we've kind of made kind of reference to a lot of times throughout this presentation, there is digital exclusion isn't just one kind of problem that can be solved by this. There are many different things that have come together and have an influence on whether an area or a community of people are at risk of being digitally excluded. And as we kind of referred to before, we've got these into four kind of key domains. So I will quickly just touch on those now individually. So the first one here is looking at digital access and capability. And as we've kind of touched on, this is physically be able to access the broadband mobile data in your areas. And you can see from the map on the right, the darker areas are where the areas are more at risk from domain one. So certainly in London, for example, we've got very, very kind of the light colours there, which means that the issue isn't much of a play there. But if you look at some of the rural areas, more so in the southwest, kind of the west of England, kind of borders Wales, east of England, over there on kind of the other side of England. And as you kind of venture into the north as well, there are areas where I've got some very rural communities where the broadband speeds are either not there or very, very poor. Maybe mobile data, you don't get maybe your 4G, your 5G you're used to in your urban areas. You maybe not getting anything. Sure, if you've ever been to a campsite or to a rural cottage and you're there with your phone in the air trying to get some signal, these things do happen across England. Not everyone has got exceptional internet speeds and coverage. So that is kind of domain one. Firstly, looking at physically access to the digital space. Second one, domain is around these areas may have access, they may have the technology, the infrastructure, but can people afford them? Can they afford devices, mobile phones, computers, laptops, tablets? Can they afford your monthly Wi-Fi subscriptions? So within this domain here, we certainly look at the communities of people where there are great financial pressures. So this looks at things like deprivation, specifically the income domain, looking at maybe where there's housing insecurity, and also looking at cost of living pressures. And again, you can see on the map there isn't really any sort of key areas there. It happens across the whole of England. It's hard to really say from on that map there where these areas are great at risk. And this is something I really want to kind of highlight throughout this presentation today, is that there isn't this kind of nicely pockets of people where you can go, okay, we need to make some targeted effort here and targeted effort there. It is a whole kind of national issue that we are facing. And then the third one is looking at ability and skills. So these are maybe where got low educational attainment, or maybe English is not their first language. And we have communities of people where may need the information provided in a separate language so they can understand it. If you just provide it in plain English, they may not be able to understand and interpret that, but also maybe looking at kind of sign language as well. And then finally, kind of looking at those communities where there's disabilities or long-term illness, which may impact the ability to use and kind of use the devices. And then finally, domain four, which is looking at kind of agency, motivation, and trust. So as Carol referred to in the previous slide, there are kind of lots of homes within England where adults are of an older age and have no access to internet. That may be choice. They may not have been brought up using digital technology and maybe like to use the paper-based forms, for example. Or it may be that they're living alone and they haven't got that support to be able to go, okay, this is what you've got to do to fill out these forms online, or here's how to get a GP appointment. And then finally, we kind of factor in things around the trust and online safety concerns. So this is looking at kind of internet misuse and fraud. So where that is more common in certain places, you may start to see people go, do you know what, I'm not using the internet because I've heard that my friend has been scammed out of X pounds, or they downloaded a virus to their computers. Therefore, do you know what, I'm going to stick to paper. So that is a factor to consider when looking at digital exclusion. So this is the four domains and the three indicators within each domain that have been built up to this DERA. So now I'm going to just show you the application that we have built. So this is the Digital Exclusion Risk Atlas, and it is an interactive geospatial product. So if geospatial is a new term to you, basically that means we take data and anything with a spatial element, so something you can put a location to, we then can convert that into a kind of visual interpretation. So this on the screen here is the Digital Exclusion Risk Atlas for England. And on the left here, you can see the legend, and those dark areas are areas most at risk, and the kind of yellow areas are where we're least at risk. And the data is split up into deciles. So that is kind of 10 equal groups. So decile 1 is the 10% most at risk. And as I said, this is an interactive tool, so you can click and pan on the map. You can zoom in and out. I haven't got all day. I'd love to spend an hour, 2 hours taking you through a real in-depth training session, how to get the most out of this. But I want to just today give you a flavor of what's in the tool, hopefully get some of you excited about how this could be useful within your line of work, and then provide the kind of the mechanisms to get you online, get you using this. And hopefully we'd love to hear some of your stories eventually about how this has helped within your line of work. So this is the national view. As I said, it's not evenly distributed. It does vary quite considerably across England. And digital exclusion, you cannot fix or make areas more digitally included on a national basis, because every area has different challenges. And I just want to kind of showcase that now. So if I, for example, pick at the top here, you've got some set of filters. We're going to look today at local authority districts. And in particular, we're going to focus on Somerset. So if you click on that, you'll see the map then filters and zooms you to that area. So currently, we're looking at the local authority district of Somerset, and you can see how Somerset is kind of varying from their deciles. For example, if I click on that decile there, you get a sidebar pop up here. And in this information panel here, it does tell you more about the data. So it tells you the DERA score, so a score of 41.32, and the higher the DERA score, the higher it is at risk of being digitally excluded. It tells you the decile, which we kind of knew from the legend, and it tells you the rank out of all of the 33,755 lower layer super output areas, which is what the tool being built upon. And this is where I wanted to pay particular attention to right now. So I mentioned before around the different domains and the drivers behind digital exclusion. And what you can see here is for the LSOI I clicked on, the deciles, and that's where we're going to spend some attention to today, is look at the deciles for each domain. So for digital access and capability, we're in decile 1. For agency motivation and trust, we're in decile 1. So we're in the top 10% of being at risk for those two domains for that LSOA. So when we look at the drivers behind digital exclusion in this area, the data shows that it is because of, potentially, I would say there's always a caveat, this is just taking national data sets. There always need to be a more of a local knowledge input into this, but the data is suggesting that the internet connectivity, mobile broadband, is potentially poor in this area. And also maybe you've got communities of people who are of the maybe older age categories, or maybe are choosing actively not to use digital technologies because of the kind of stories around fraud and data misuse. And then if you look at the other two, they're deciles 6 and 4. So the data is suggesting that these two are the main reasons as behind why this area here is digitally excluded. If, for example, I was working for Somerset Council or working for a charity in this area, and I had some money to potentially look at improving, making these areas more digitally included rather than excluded. Looking at this map right now, it is quite hard to tell potentially where the areas are most in need, because it is quite all in those kind of shades of blue. And what we have added to this filter list at the top is the ability to change from national deciles. So a national decile is we've taken all of the data nationally, we split it up into those 10 equal groups. You can now change it to local deciles, and this now changes that data. It takes those data just purely for Somerset Local Authority and reclassifies it into deciles 1 and 10 again, but only using Somerset's data. So now we are looking at this on a much more local scale, and we can kind of see from this map clearly where the areas within Somerset are more at risk of being digitally excluded. So you can see now it's more on the west side and potentially the east side. And again, if you want to look at maybe just those, the 20% most at risk, you can turn on deciles 1 and 2 in the filter there, and it will show you that picture. I want to now take you to a different place. So let's now take you to, let me just quickly reset those, because it does nicely, helpfully at times, keep them on. So let me change now to Birmingham. And I just want to show you that you've still got some very dark colours in your most at risk. But if I click on one of these areas, you will suddenly see how the picture here is very different. It's decile 1, just like it was in Somerset. So this area, this LSOA, 48C, and that one we had in Somerset are both in the top 10% of being at risk of digitally excluded, but for completely different reasons. So whereas in Somerset, it was digital access capability was a decile of 1, and agency motivation and trust was 1. In Birmingham, it's the complete opposite picture. Actually, it's affordability. So they've got the connection speeds. They've got decile 10. They've got the super fast broadband. They're in Birmingham city centre. They can have 5G. So that's not the issue here. And likewise, the populations are maybe more of the younger generation. So they've been brought up using the technology. So it's not necessarily having ability to be able to use the device. It's purely down to potentially affording devices, affording broadband, and also maybe it's due to that you've got communities of people in this area who English isn't their first language. So when you present technology information in English, they're struggling to understand it. So therefore, they can't access this, and therefore they are at risk of being digitally excluded. It may be that these areas have got some further training to do. Maybe they've not been kind of educational, entertainment-wise, has been into the poorer areas. So maybe they need some training as well. So that is just really what I wanted to highlight within this demonstration today is digital exclusion isn't the same everywhere. I've showed you 2 areas here, and I could take you through every single local authority across the country, and every area will be slightly different. You'll have areas that are, for example, maybe not at risk as much, and then the areas which are highly at risk. And as you can see in Birmingham, they could potentially be neighbouring. So another thing I just wanted to touch on as well is there's been a lot of comments, a lot of talk around IMD, so deprivation and core 20. And Yes, there are areas where deprivation and digital exclusion is very linked. So I'm just going to quickly flick through the page at the top here, and I'm just going to look at compare data sets. As I said before, it does nicely remember your filtering that you set as you pan through the pages. So I'm going to go back to Somerset, for example, and I'm going to show the DERA, and I'm also going to show you the deprivation. If I select deciles 1 and 2, so in Somerset, we've got the 20% most at risk here on the screen, and this is nationally, as it's set the national decile. So it's got quite a few of the areas. But if you look at the IMD, so deprivation, there aren't too many areas. There is a couple, but there's not, compared to the DERA, there aren't as many. So what we can say here is that potentially in Somerset, deprivation isn't just the driver. There's been, I think, a lot of kind of there's a lot of kind of thoughts that the deprivation is directly linked with digital exclusion. Yes, it is a factor to consider, but it isn't the only factor. So here is just a quick example of how to get the most out of the tool, how you can use some of the filtering, what it can show you. Along the top here, we've also got each individual map, as I kind of showed at the start. So you've got digital access capability. Let me just turn that back to all. So you can look at the digital access and capability domain. You've got the affordability and economic pressure. So now I'm not wanting to play ball. It would have showed you that. Let me make a quick refresh. There we go. You've got the domain 3 ability and skills, and you've got your agency, motivation and trust as well in your fourth page. And again, if you click on an area here, you also get the breakdowns of the individual data sets. So if you're on the DERA page, the first kind of tab here, you get the data broken out by the 4 domains. If you actually go and visit one of the maps, each domain map, you then get the breakdown of the data. You can export the data. So if you want to take your data away and do some of your own kind of BI reports, or you want to take the data and put it into Excel, you can do so through the export function. There's some nice, hopefully nice guidance there on how to do that. But what I kind of want to finish with, because we've got about 20 minutes left and we've got a few more questions in the Q&A, is this is obviously built on a national scale, but the real value comes from a local scale. So your areas that you're working within, or there's maybe funding in certain areas that you gather, this tool is really allows you to go and see which areas are most at risk within your local areas. So you can view that at local authority districts, or if you're from a healthcare setting, you've got ICBs and you've also got primary care networks. This page here, compare data sets, allows you to compare 2 data sets for a same area, whereas you've got compare areas. So you can start to compare 2 different areas together. So you can compare local authorities on one, local authorities on the other, and you can compare between Amber Valley and, just for demonstrations, I'm not too sure what these both are. They're nowhere near each other, but you can start to compare 2 areas, maybe side by side. On the home screen, so when you first load, you'll get to his page here. If you need any support, you've got a user guide, which will take you through how to use the tool. So if that demonstration was not enough, you've got any other questions, then please use the user guide there. That hopefully will take you through how to get the most out of the tool. We've got methodology. So if you want to know more about how the tool's been built, then this has all been documented here. As Carol said, it's a public resource. We want people using it, and we want to be transparent about how we've done this. So it's all been listed and written out through the methodology guide. We've got contacts. If you need to contact us for whatever reason, you've got our contacts there. Feedback, really, really important. We want to make sure that this tool is useful for people. We want to make sure people are getting the most out of it. If there's things it's doing really well, let us know. If there's things that, oh, it'd be really great if you could just do this or we could do that, let us know that, because this tool, hopefully, we'll continue to develop as a useful resource available for the kind of the public. And then finally, case studies, really, really important. We've built this tool in the hope that this gets used, and we really want to hear some of those stories about how this has been helpful. So whether this is supporting a project or supporting an area, please do let us know. And there's a nice form that you can fill out to just let us know where you use the data and how instrumental it's been to support. So that is kind of a very short demonstration from myself. Just wanted to kind of reiterate that it is place-based action. So we're really looking at building the data at LSOA level, so the most granular data we get hold of, to enable you that fine-grained local analysis. Be able to explore your variation across your small areas, so your towns to kind of cities, but also regions, local authorities. And hopefully this tool, combining 12 different variables together, gives you a better idea as to where digital exclusion takes place nationally. Carol, back to you.
Brilliant. Thank you, Will. I always learn something new. Even though I've been right from the beginning of building this tool, I always learn something new from you. So thank you so much for this. Just very quickly before we open to the Q&A, as you can see there, you can access DERA in three ways. We've got the direct link that I shared for you in the chat box. We do have also a dedicated page on the Futures website for those who do not know about Futures. This used to be called NHS Futures, which is a space where colleagues working in healthcare can share important information, new changes to a program, etc. So we've got a dedicated page there. The only caveat I would say is that it does require a login. Otherwise, you can directly access it through the web page, through the NHS England's one, and there is a direct link to the tool as well. What I would say is that we are obviously looking at and responding to one of the questions in the charts about the tool is as good as the data that feeds into it. And whilst we are saying that it gives us a picture of digital exclusion, it is always going to be an approximation of what that digital exclusion may look like. It may be, for some, it may be just a starting point of a conversation. For example, if you're thinking about a whole pathway design, that sort of information and data may be very, very beneficial for you. But it is an approximation to the truth. It will never be and cannot be a full truth. So just wanted to really caveat that. And building on the point that Will made earlier about your local knowledge is absolutely crucial in all of this. Your voluntary and community sector organizations are absolutely crucial within that as well, because they will always help you to understand where DERA will show you the patterns of digital exclusion. Your local knowledge will help you to bolster that information and to really understand where the needs may be the greatest, what sort of intervention may be needed on the basis of that data that we are providing you.
Thank you both so much. And I think Will, that was an absolute masterclass, and I realised we probably could have a one-day conference with many different training sessions just on how to use it. But that was
Yeah,
brilliant.
trying to cram into 20 minutes is always very tough. So yeah, normally I could spend half a day talk it through and working individually with people. It's really kind of proud of what we've built here. So it's good to see all those comments in the chat about how great it looks. So thank you.
Fantastic. And I think as well, Carol, that's really, really important context around how the map is used. And I think I'm right in kind of summarizing that this has really been built with local people in mind, local practitioners, local ICBs, local digital inclusion groups being able to overlay this national data that is available at LSOA level with the understanding that you will already have in your own area of some of the opportunities that there may be around digital inclusion, but also potentially being able to compare and contrast that and think
Yeah.
about why is something not hitting in the way that you want it to, and being able to come back to that data and say what's the connection, what's the contrast, why might that not be working. I'm going to come on to some of the Q&A because we have 10 minutes left and we have a whole raft of questions, which is brilliant because we love when people want to dive into it and get involved. So I'm going to ask hopefully a fairly simple question to Will first. Can DERA be shared in other GIS systems? So Parish Online is one example, but obviously there's ArcGIS and all sorts of things.
Yeah, so currently the maps themselves are shared through the URL that's in the chat through the NHS England page, but the data is there to be exported if people would like to take that data and create their own maps or put it into their own systems. That data is all exportable, as I showed in the very short demo.
Amazing, thank you.
And can I just add to that, Elizabeth, if that's okay? We've been also very, very keen to be transparent as much as we possibly can with how we built the tool. And therefore, when you go onto the landing page of DERA and you click on the methodology section, you will see exactly how and why we developed this tool. We wanted to ensure that people, when they are looking at the data, they really understand, if they wish so, if they wish so, I need to caveat that, they are able to understand what they are looking at and why are they looking at it in such format. So, for example, you will see that there is an interpretation guide. There is the whole methodology overview that is available there. There is a better explanation of why we have chosen these particular variables and how we weighted them, because not all the variables in there are weighted at the same level. So all that methodology is there for you to look at, to scrutinize, to shout at, to challenge. It's there.
That is great. And if I could ask if you could pop a link to that page in the chat where people can find that methodology, that would be great, because we are getting a few questions about how percentages are calculated, how data's been chosen. Another question coming in from Penny is, will this tool be maintained as data changes? And she reflects that locally they undertook a similar project, but it was a snapshot, so the data is becoming less useful as it ages. And I think that's something we've experienced with the internet user classification as well. Will that maintenance be a facet of this project?
So I'll let you answer the first part of the question and then I'll answer the second part. So if you could just answer the case.
Yeah, certainly. So in terms of data updates, we've recently just done quite a few. So we just, I think it was beginning of June, we brought through all the latest ICB geographies. If you're from kind of the NHS world, integrated care boards, we brought those through. We also updated some of the data sets which had refresh cycles of being more recent. A lot of the data sets, I'll be honest, are kind of, some of them are census. So we are waiting for the next census release, which is some way away still. But there are some geography, some data sets which are updated more regularly and refreshed. And our hope is to keep those maintained as much as we can.
Indeed. So I'll answer the second part of it. So for now, as it stands, we've got our GIS support up until the end of the financial year, which is 31st of March, 2027. And here's my ask of you. On the landing page, we have put the button for the case studies. The more case studies come through from you to show us how you are using the tools, the more power, if I may put it that way, we will have in negotiating the longevity of that tool. I am very, very keen that it will continue to live its life. It will continue to provide the data that is needed for the systems and for all of you to look at and to work with digital exclusion. But we also need your help so that we can negotiate that with the powers that be, so that the DERA can be kept up to date as much as it possibly can.
I think that's a good piece of homework for us all. Don't let perfect be the enemy of good. Get something back to the team at NHS England so that they know how this is being used. Rachel has asked a question that I wanted to ask, which is, do you know if there's a similar DERA process being planned in other UK nations? So she specifically says Scotland. Do you connect with other NHS colleagues around the UK?
We don't, to answer it plainly and simply. As I say, we work for NHS England. However, we've had some contact from NHS Wales, and they were looking at developing similar tools. Where they got into with that development, I cannot answer that. But what I also wanted to recognize is the fact that DERA is not the first tool that is providing a visibility of digital exclusion. For example, we've got the Greater Manchester Risk Index. We've got in London, the London Office of Technology that have developed their own spatial map. And we've built on that because one thing that we recognized is that we didn't have a tool, an atlas that looked from the national level down through the ICB, local authority district, PCN, and down to the lower layers super output area. Another sort of side note I wanted to add to this, that we specifically do not identify individuals in these data sets. So that's why the lower layer super output area is the lowest that we can go to. It's also what the data sets are allowing us to do. But these are the communities, or these are the areas that have between 1,000 to 3,000 people. So this is, we are going from the national big picture down to a very, very, very small area. And I think that's the exciting part. And I'm sure that others in Scotland, Wales, or indeed Northern Ireland may use that methodology to develop their own atlases to help reduce digital exclusion.
Fantastic. And I think it's absolutely fantastic that this is such an open source tool that people can really learn from, can really understand how it's been put together, can interrogate that data.
Yeah.
And certainly for those using the data within England can come back to you with their feedback, their suggestions, even if it's, something where they maybe think it needs to be done better, that actually you are so receptive to
Absolutely. Yeah. Two separate buttons, one for case studies, the other one for feedback. Please use both.
Positive vibes only in the case studies, I suspect. I can say that because I'm independent. And a final quick question before we finish up, which is from Sharon. How can this be used alongside other tools? So, for example, transport-related social exclusion tool built by Transport for the North, Coastal Navigators Network. Are there opportunities to be able to combine this and work collaboratively with other organisations?
Yeah, Will, do you want to take that question first?
Yeah, certainly. So there's many kind of ways we can support. So we've Carol and I are in engagement with other organisations, academias, other kind of organisations across England around where DERA can be support other projects. Certainly, some of those examples there in the question are just another reason where another factor which could be included into digital exclusion is, as I said throughout the presentation, there's many factors. We haven't included every single one because there'd be too many to include in a tool. So there is certainly a space to compare, contrast between different tools. As we kind of made reference to, this tool is there to support but not make decisions for you. So it's probably a case of taking some of the data sets and some of the answers from DERA tool, bringing it together with other tools to really kind of give you that all that evidence to hopefully make all the evidence plus your local knowledge to come to a decision that is using data to support your kind of decisions.
Amazing. Thank you so much, Carol and Will, not just for the session today, which has been fantastic, but for the huge amount of work that has gone into creating something that actually I think was a real gap in terms of how digital exclusion can be explained, interrogated, understood, certainly across England, and hopefully an inspiration for other areas as well to see just what can be created with this geospatial analysis. Thank you also to everyone who has joined us today. Thank you for getting so involved on the chat. Thank you for asking questions. It is these live sessions where we can actually kind of share ideas, debate things, come up with different solutions that is so important. Do make sure that you keep an eye out for our next webinar sessions, which will be happening through September and October. We will also later on this week, be sharing details of how you can get involved in End Digital Poverty Week, which will be starting on the 7th of September. So do watch out for that. Do sign up to come along to our gala, but do think about what you can do in your local community or your organisation. If you're not already on our mailing list, please do also sign up at digitalpovertyalliance.org. Scroll down to join our community and you'll be able to sign up for our mailings there. Again, a big thanks to Carol and Will, and we will see you all again soon. And do remember to put your case study on that DERA website. Thanks so much.
All
Take
the
care.
best. Take care.
Bye.
Bye. Bye.